Hey everyone, welcome back. And today we're going to be talking about how a person-centered therapist might treat obsessive-compulsive disorder. So let's find out. Person-centered therapy, also known as Rogerian or client-centered therapy, is founded on the belief that individuals have an inherent tendency towards self-actualization and positive psychological growth. While not the primary or evidence-based treatment for obsessive-compulsive disorder, OCD, a person-centered therapist would approach it with the core conditions of empathy, unconditional positive regard, and congruence. Here's how a person-centered therapist might approach treating OCD, acknowledging that this would likely be alongside or in preparation for more targeted treatments, like exposure and response prevention, or ERP. 1. Creating a safe and accepting environment. The foundational steps would be to establish a therapeutic relationship built on trust and safety. The therapist would offer unconditional positive regard, meaning they accept the client without judgment, regardless of their OCD symptoms or the content of their intrusive thoughts. This is crucial for someone with OCD who often experiences immense shame and guilt related to their obsessions and compulsions. 2. Empathic understanding. The therapist would deeply listen to and understand the client's experience of OCD. This involves truly grasping the distress, anxiety, and impact that obsessions and compulsions have on their daily life. Instead of trying to fix the OCD, the therapist would seek to understand the client's internal world and reflect their feelings and experiences back to them, helping the client feel heard and validated. 3. Congruence or genuineness. The therapist would be authentic and transparent in their interactions with the client. This genuineness fosters trust and allows the client to feel comfortable being vulnerable about their highly personal and often distressing OCD symptoms. 4. Facilitating self-exploration and awareness. While person-centered therapy is non-directive, the therapist would encourage the client to explore their thoughts, feelings, and behaviors related to OCD. This self-exploration could help the client identify the personal meaning of their OCD. While OCD is a neurological condition, there might be underlying anxieties or stressors that the compulsions are attempting to manage, even if in an unhelpful way. The client may gain insight into how the OCD developed or what triggers it for them. Understanding their values. Person-centered therapy aims to help individuals move towards self-actualization. Exploring their values and what truly matters to them can sometimes provide motivation to challenge OCD behaviors that interfere with their desired life. And recognize the impact of OCD. By openly discussing their experiences, clients can gain a clearer perception of how OCD limits their life and impacts their well-being. And number 5, empowering the client. A person-centered therapist views the client as the expert in their own experiences and inherently capable of finding their own solutions. They would not tell the client what to do, but rather support them in discovering their own strengths and resources to cope with OCD. This might involve building self-compassion, helping the client challenge self-blame and shame associated with OCD, strengthening self-trust, encouraging the client to trust their own capacity to manage distressing thoughts and resist compulsions, and fostering a sense of agency, empowering the client to take an active role in their recovery journey. Limitations and integration with other therapies. It's important to note that while person-centered principles are beneficial for building rapport and creating a supportive therapeutic environment, person-centered therapy alone is generally not considered the primary or most effective treatment for OCD. The gold standard treatment for OCD is exposure and response prevention, ERP. A specific type of cognitive behavioral therapy, ERP directly addresses the behavioral and cognitive components of OCD by systematically exposing the individual to their feared triggers, while preventing them from engaging in their compulsions. A person-centered therapist, recognizing the limitations of a purely non-directive approach for a complex disorder like OCD, might integrate elements of other therapies. While maintaining a person-centered stance, they might introduce psychoeducation about OCD, discuss coping strategies, or gently explore readiness for more structured interventions like ERP. Some person-centered therapists are open to integrating techniques from other modalities such as mindfulness, if they believe it would benefit the client. And refer to specialists. If the client's OCD is severe or not responding to a purely person-centered approach, a responsible person-centered therapist would likely recommend or refer the client to a therapist specializing in ERP or other evidence-based treatments for OCD. In summary, a person-centered therapist treating OCD would prioritize creating a deeply empathic, accepting, and genuine space for the client to explore their experiences of the disorder. While not directly addressing the compulsive behaviors in the same way as ERP, this approach could help the client feel understood, reduce shame, build self-awareness, and potentially empower them to engage more effectively in other more targeted treatments. So what do you think? What are your thoughts about person-centered therapy as an approach for obsessive-compulsive disorder? Let me know in the comments, and I'll speak to you next time.